Decontaminate your hands and wait for the tray to dry for 3 minutes. During this time, you can gather the equipment onto the trolley. Make sure that there is a sharps bin to hand. Do not put the unopened equipment in the tray at this point. You must now decontaminate your hands. Check that all of your equipment is in date. Open the chlorhexidine wipe. The saline must be checked by 2 members of staff. Clean the neck of the saline bottle and allow this to dry. Open the 10mm syringe and connect it with the drawing up needle. Make sure that you retain the packaging of the syringe. Draw up the flush using the needle and syringe. Keep the saline bottle for reference in case the patient develops a reaction to the flush. Once you have completed drawing up your flush, place the needle immediately into the sharps bin. Remove any air from the syringe and place it back into its packaging. This protects the key component. You now need to flush the binectar line until you see the saline appear at the distal end. To do this, pick up the binectar packet and partially open the hub end. Holding the binectar just below the grey hub, insert the tip of the syringe and turn it in a clockwise direction. You must ensure the rest of the binectar remains within the packaging and the key part of the syringe and the binectar are not touched. Place the syringe back into the original packaging and gather the rest of your equipment. Place your apron and gloves onto the clean trolley. You should now decontaminate your hands and proceed directly to your patient. Once you're at the patient's side, make sure your equipment and sharps bin are within easy reach and decontaminate your hands. You should reconfirm the patient's identity against an official hospital document and confirm that the patient is happy for you to proceed. Position the patient so that they are comfortable and apply a disposable tourniquet to help locate a vein. It is good practice to initially attempt to cannulate the back of the patient's hand and work up towards the antecubital fossa if there is no suitable vein. Once you have located the vein, release the tourniquet until just before you perform the procedure. Don your apron and gloves. Take the cannula pack from your equipment tray and open it. You must keep the wrapper of the cannula pack as it has the cannula care pathway stickers. Open out the contents of the pack. Remove the ChloraPrep applicator from its packaging and squeeze until the inner tube breaks. This releases the ChloraPrep solution. Clean the proposed puncture site in a hash formation and allow to air dry for 30 seconds. Dispose of the ChloraPrep into your sharps bin. Reapply your tourniquet to help distend the vein. Do not repalpate the cleaned area of skin. Take the cannula and fold the wings flat. Remove the sheath from the needle and place in the sharps bin. Your fingers must not touch the needle. Apply traction below and to the side of the proposed puncture site to help immobilize the vein. Advance the needle, bevel up, into the vein at an angle of approximately 30 degrees. Care should be taken not to insert the needle so far that it continues through the vein and out the other side. You should observe a small amount of blood, the primary flashback, in the flashback chamber, as can be seen here. Advance the device a small amount to ensure the cannula is within the lumen of the vein. Securely hold the end of the needle and push the cannula forward off the needle into the vein. You should notice blood moving up the cannula. This is known as secondary flashback and indicates that you can now release the tourniquet. Hold the needle still and advance the cannula fully into the vein. Remove the prime bionector from its packaging. Press the vein distal to the cannula entry site to reduce the blood flow from the cannula. Remove the needle and dispose immediately into the sharps bin. Unscrew the white cap protecting the key part, and while supporting the cannula, screw the bionector onto the end. The cannula should then be secured with a sterile dressing. Start by removing the strips and place them on the wings of the cannula. Peel off the main dressing and wrap around the cannula as shown here. Remove the backing, saving it as you will require the date sticker. Before you flush the cannula, you will need to decontaminate the bionector with a chlorhexidine wipe. Flush the cannula by securely holding the bionector away from its key part and connect the syringe prepared earlier. Flush with 5 ml of normal saline, watching for tissuing at the cannula site. If tissuing occurs, the cannula is not within the vein and you should restart the procedure. Remove the syringe and dispose into the sharps bin. Clamp the bionector and dispose of the tourniquet. Ensure that you document the date of insertion using the sticker provided on the dressing and place next to the cannula site.